A lot to talk about on today's Two on Your Side Town Hall, including new rules for schools. We'll have a local superintendent back to react to the mandates coming out of Erie County today for districts to follow as they reopen. Plus, full approval, a look at what it means now that the Pfizer vaccine has the unconditional green light from the FDA. And the challenges ahead for Governor Hochul. We'll talk with an expert about the challenges for the next governor, particularly as the first woman in that job. And we thank you so much for joining us here on the Town Hall. I'm Kate Welshofer. Michael's on assignment tonight. And we're going to start this evening with that announcement that affects pretty much anyone with kids in Erie County, those new guidelines the county put out for school districts as they reopen in the next few weeks. Here are some of the highlights, and the big ones are right there. Regardless of whether you're vaccinated, everyone in school has to wear a mask indoors. They are recommended outdoors as well. So the county didn't set specifics for things like distancing, only recommending that it be done as much as possible as long as it doesn't keep kids out of the classroom. So you'll see more on the bottom of your screen throughout this segment. In the meantime, we've got reaction on two fronts tonight. We'll hear in a minute from our pal, Dr. John Sellick, but we want to start with Sweet Home School Superintendent Michael Ginestre. We're glad to have you back, and we had you on a week ago talking about how you were planning without much guidance. A few quick questions for you now that you do. Are these guidelines what you expected, and do they help you better prepare now for this school year?
They are along the lines of what we expected to come out of the county, and we're appreciative of all the work that they have done. And they've partnered with superintendents over the past month and talked to us and asked for our input regarding these guidelines. So while they were expected, I think the great thing out of this, and the thing we're most excited about, is to bring all of our students back for 5-day-a-week in-person instruction and get them back in the classroom in the safest manner possible. And we really appreciate the work that local superintendents did, my colleagues did, along with the county, to come up with these guidelines to get students back in school and to keep them safe.
Something we've heard time and time again of people wanting that goal of being able to have kids back in school. We'd like to play you the county executive's response today when he was asked about the input that schools had in this.
We had district representatives say, please implement a mask order, because we don't know if we can enforce it on our own, but we know you can. And there needs to be equality across the county, where one district is not, another district is, and they happen to be in the same town. They're just multiple districts in one community. So we listen to them.
Anytime you talk about masks, the enforcement question always comes up. So the question here is twofold. Do you think schools were involved enough as part of this? And does the fact that there is a mask mandate now help you in terms of enforcement?
I'm sorry, can you repeat that? You froze on me for a second.
Oh, sure. So we want to know, do you think that schools were involved enough? And is the fact that there is now this mask mandate, does that help in terms of enforcing it?
I do think schools were involved enough. In fact, I personally participated in a small group with the county and their school health team to gather input and to talk and have a discussion about what it would take to get kids back into school 5 days a week for in-person instruction safely. I do think the mask mandate helps keep a uniform policy so parents aren't confused and aren't questioning what school district has it, why does this school district have it and not this school district. And so to make it uniform across the county, I think helps us all. And it's all about safety. It's all about keeping our students back in the classroom and keeping them safe. And whatever we have to do that, we will take care of it. So I appreciate the county's work. I felt very involved in the process myself. And I think they did a great job in coming up with this guidance.
And finally, there are still a lot of questions. There always are about what else this affects, especially something like sports, now that the county has moved into the CDC's high-risk category. So what kind of discussions are you having about that part of school? Because it's so important for so many parents and students. Now that you have these guidelines, is it something going forward that's going to continue to be a challenge?
It's always going to be a challenge when you get away from the norm of pre-COVID times. So we're going to protect our athletes, our student athletes, and everybody participating in extracurriculars as much as we possibly can. But we feel that those activities are critical for their mental health, their social health and well-being. And so when they're not participating in the field of play, we're going to ask them to wear masks. We're going to ask them to keep distance as possible and report to us when they're not feeling well or when tests are required. So to keep those activities going and try to create those norms back again are so important for our students and their development. And we're going to do whatever it takes to keep them on the field of play and on stage and all of their other extracurricular activities.
We appreciate your perspective. We have been talking with Sweet Home Schools Superintendent Michael Ginestre. We know you're awfully busy, so thanks again for joining us.
Thank you for having me anytime.
And now we're going to welcome in Dr. John Sellick from Kaleida Health. And Dr. Sellick, based on what you've seen, are the guidelines here reasonable? And do you think they're actually going to do what they're setting out to do, which is keep kids safe?
Yes, I think they're very reasonable and they're going to be successful. If you look at what's happened over the course of the pandemic as a whole, but especially over the past years, there are many mixed messages, confusing points. And I think that these guidelines are based on very good evidence. We now have very good evidence of mask use, especially with the COVID variant now being our dominant strain in Western New York and most of the country, and the ease with which that spreads. I think the other thing that was very well done with the guidelines is what we refer to as a layered approach. So it's mask use, ventilation, distancing, all of this plays in together. None of them are separate from one another, and the guidelines looked at that very carefully. And again, all of these important issues related to sports and other particular activities, especially those that involve, singing, acting, musical instruments, that have been a big problem both at the professional level and at the school levels. I think that these guidelines address all of those. And if these are followed well, there's no doubt we're going to have some cases along the way, but I think this will minimize the amount with which we see students getting sick and spreading infection.
You sort of mentioned we do know so much more now than we did last school year, but we still know that there are parents who are going to push back against some of these guidelines. Some have already threatened lawsuits. If one of them, Dr. Sellick, was a patient of yours, what would you say to them about that viewpoint?
Well, that's a really good question, because I think you have to look at it from the point of view that there are potentially a lot of lives at stake here. So everybody likes to keep quoting these various statistics that kids get sick very infrequently and we don't have to worry about it, they do fine. Well, there are two things that happen if a kid gets infected. Number one, they may bring it home and bring it to a parent or a grandparent or someone else who is at very high risk of a bad outcome. The second part of this, that even though the rate of these bad things happening to young kids is very low, there are between 45 and 50 million kids under the age of 12 years old in the United States. So even if something is a 1 in 1,000 or a 1 in 10,000 event, when you multiply that by 45 million, you're then all of a sudden talking about thousands of kids who may wind up in the hospital, and you're going to get some mortalities with that too. All you have to do is look at the southern United States now, and you can see that in Texas, a number of the big cities, the pediatric ICUs are all full. They are loaded with pediatric COVID cases. So I would encourage, if a parent raised this question with me, I would encourage them to look at that. You may think of it as a numbers game, but if your kid is one of the ones who's in the hospital, it's not going to be very good.
We have about under a minute here, Dr. Sellick, but in the midst of this discussion locally, we have the big news that the FDA gave full approval now to the Pfizer vaccine. So now that we're here, what might change with people who are able to get vaccinated, but they're still choosing not to?
Very good news. We were expecting it. We were hoping by Labor Day. So the fact that it came this soon was very good. We now have, when you look at it from the perspective that we're 12 months out from when Pfizer started their trial. So we have 12 months of follow-up on some of these people and many months of follow-up on others. And what we have seen is that the number of serious side effects is extraordinarily low, but the protection is extraordinarily high. So we're hopeful that the people who are concerned that even though it was the wrong term, they said it's an experimental vaccine, that they will see that we now have an excellent safety and efficacy record, and that this will prompt some of them to now get vaccinated, because that's going to help us a lot, especially going into the fall and winter.
Kaleida Health epidemiologist Dr. John Sellick, thanks so much for being with us.
Thank you again for having me, as always.